Hi, my name is Dr. Siddarth Thakur. I'm a physiatrist at Atrium Health. So injections, or different interventional management options, are basically targeted treatments to identify what's the primary thing that's causing pain in an individual. For back pain, there's multiple sources, so injections can be helpful to actually give very specific information about the cause of the pain. So a patient would receive injections based on whatever we think the primary cause of their pain is. So you can have injections based on pain that's coming from nerves, pain that's coming from muscles, or pain that's coming from joints. So for example, if you have a disc herniation or an issue with a disc that's touching on a nerve, you can perform an epidural steroid injection. If you have a lot of pain related to joints and inflammation, you can have a more targeted treatment where you block the nerves that innervate the joint, followed by like radiofrequency ablation, or if it's coming from a different joint, you can apply local injection there to isolate the pain that's coming from a particular structure. Many people who are suffering from pain and don't get relief from the conventional methods of either physical therapy or exercise or routine anti-inflammatory medications can benefit from targeted treatments with injections. Now, again, this really depends on the patient and what their goals are for treatment, and also what their level of function is prior to their treatment, and basically what sort of limitations they're feeling related to their symptoms. There's no specific treatment or algorithm for every single patient. I think you really need to take every case individually and see what's the best treatment for the patient at that time. And that's really how you get people feeling better in a more expeditious manner. Because to say that every single patient would benefit from physical therapy, it may be true in some sense, but if you're in acute pain, can't participate in therapy, or even feel worse after participating in therapy, then there's certainly not going to be someone who's going to benefit from that and really gain all that they can. So there's a lot of times you want to make sure you can treat the pain first, whether that be through a targeted intervention or medication management, however they would get better faster. And that's really the people that you need to get targeted interventions for. So I often work with surgeons hand in hand, because a lot of the interventions that we do really target specific structures. So let's say I see an individual or patient suspect a particular diagnosis, perform an intervention, and let's say the first time I do that, it gets them excellent relief for a long, long time, and then sometimes we go ahead and repeat those interventions and they're getting less and less time, or duration of benefit is really decreasing. We know that it might be time to move forward with treatment in an operative fashion, and that's when I really collaborate with the surgeons and I let them know, this is the individual I've seen, these are problems that we've been treating, they've done really well with these things so far, but I think they really might need to have some surgical intervention to give them a more permanent solution to their problem. So I think through the SpineFirst initiative, we're really allowed to make a seamless integration of spine care. I might see someone in one office and help them, or come to a diagnosis with a problem, and I'll be able to do a warm handoff with another provider who might be in a different office. This has been a really great thing for patients, to give them focused care that's really through the spine continuum, and coming from the beginning, at the doorstep, I might help come to a diagnosis and a treatment, and might find some great remedies for them, but they may need the next step in care. And going through that journey together with primary care, even before the physiatrist, the neurosurgeon, it really has been an excellent experience for patients and great for their outcomes as well. So there's no hard and fast rule about frequency or duration in terms of injections go. We have a very individualized approach to this, so we always have people come for follow-up within 3 to 4 weeks to ensure that they're feeling better. Every injection is a little bit different, and I think it really is based on what we believe the pain-generating structure is. It's usually a combination of local anesthetic and steroid, where it may be a thermal sort of ablation procedure where we use directed heat at targeted structures to make patients feel better. A lot of times we perform a transforaminal epidural steroid injection, which allows you to place medication directly at the root of the problem. Sometimes we can perform interlaminar epidural steroid injection, which is also used to treat pain coming from a disc nerve issue. We perform medial branch block and radiofrequency ablation to treat facet joint arthropathy or arthritis in the facet joint, which may be causing significant functionally limiting pain for individuals. We do sacroiliac joint injections. We do ultrasound-guided trigger point injections to deliver medication directly into some very tight and painful muscles for myofascial pain that's commonly associated with different spinal conditions. And some people have tailbone pain, and there's interventions that you can do to focus on that by treating some of the nerves that innervate the tailbone.